A 3-year-old child presents with a 2-day history of bloody diarrhea, abdominal pain, and pallor. Laboratory tests show hemolytic anemia and thrombocytopenia. What is the most likely diagnosis? A. Hemolytic uremic syndrome HUS. B. Idiopathic thrombocytopenic purpura ITP. C. Henoch-Schönlein purpura HSP. D. Leukemia. Correct answer A. Hemolytic uremic syndrome HUS. Hemolytic uremic syndrome is also known as typical HUS when associated with E. coli O157H7. It is characterized by the triad of hemolytic anemia, thrombocytopenia, and acute kidney injury. It often follows a diarrheal illness. Treatment is supportive with dialysis in severe cases. A 6-month-old infant presents with a bulging fontanelle, fever, and irritability. What is the most likely diagnosis? A. Viral meningitis. B. Bacterial meningitis. C. Hydrocephalus. D. Subdural hematoma. Correct answer B. Bacterial meningitis. Bacterial meningitis is also known as acute bacterial meningitis. In infants, it presents with fever, irritability, and a bulging fontanelle due to increased intracranial pressure. Common pathogens include Streptococcus pneumoniae and Neisseria meningitidis. It is a medical emergency requiring prompt antibiotic treatment. A 9-month-old infant presents with sudden episodes of crying, drawing legs towards the abdomen, and vomiting. On examination, a sausage-shaped mass is palpable in the right upper quadrant. What is the most likely diagnosis? A. Gastroenteritis. B. Intussusception. C. Appendicitis. D. Gastroesophageal reflux disease. GERD. Correct answer B. Intussusception. Intussusception occurs when a portion of the intestine telescopes into an adjacent segment, causing obstruction. Classical signs include sudden onset colicky abdominal pain, crying with leg drawing, vomiting, and a palpable sausage-shaped mass. Current jelly stools may also develop. Ultrasound confirms diagnosis and treatment often involves air or fluid enema reduction. A 4-week-old infant presents with projectile vomiting after feeds. On examination, an olive-shaped mass is palpated in the epigastrium. What is the most likely diagnosis? A. Gastroesophageal reflux disease GERD. B. Pyloric stenosis. C. Intussusception. D. Hirschsprung disease. Correct answer B. Pyloric stenosis. Pyloric stenosis involves thickening of the pyloric muscle. This blocks stomach emptying, causing projectile vomiting. The olive-shaped mass is key. Diagnosed via ultrasound. Pyloric stenosis is treated surgically by pyloromyotomy. A 5-year-old boy presents with progressive muscle weakness, difficulty climbing stairs, and cough hypertrophy. What is the most likely diagnosis? A. Cerebral palsy. B. Duchenne muscular dystrophy. C. Juvenile idiopathic arthritis. D. Myasthenia gravis. Correct answer B. Duchenne muscular dystrophy. Duchenne muscular dystrophy is an X-linked genetic disorder. The short form of this disease is DMD. DMD causes progressive muscle weakness and cough hypertrophy, pseudo-hypertrophy. Gower's sign, that is using hands to push up from the floor, is common. A 3-year-old child presents with a vesicular rash on the trunk and face, fever and itching. What is the diagnosis? A. Measles. B. Varicella, chickenpox. C. Hand, foot and mouth disease. D. Scabies. Correct answer B. Varicella, chickenpox. Varicella is caused by the varicella zoster virus. It presents with itchy, fluid-filled vesicles on the trunk and face. Fever and malaise are common. The rash appears in crops and crossover. Treated with supportive care or antivirals in high-risk cases. A newborn presents with prolonged jaundice, poor feeding and hypotonia. Screening tests reveal low T4 and elevated TSH. What is the most likely diagnosis? A. Congenital hypothyroidism. B. Galactosemia. C. Phenylketonuria, PKU. D. Cystic fibrosis. Correct answer A. Congenital hypothyroidism. Congenital hypothyroidism results from deficient thyroid hormone production. Symptoms include prolonged jaundice, poor feeding, and hypotonia. Newborn screening shows low T4 and high TSH. Developmental delays can be prevented in this condition by treating with levothyroxine. A 1-month-old infant presents with failure to pass meconium, abdominal distension, and bilious vomiting. What is the most likely diagnosis? A. Hirschsprung disease. B. Pyloric stenosis. C. Intussusception. D. Necrotizing enterocolitis. Correct answer A. Hirschsprung disease. Hirschsprung disease is caused by absent ganglion cells in the colon. This leads to functional obstruction, delayed meconium passage, and abdominal distension. It is diagnosed with rectal biopsy. A 2-day-old newborn presents with cyanosis that worsens with crying. Chest X-ray shows a boot-shaped heart. What is the most likely diagnosis? A. Transposition of the great arteries. B. Tetralogy of Fallot. C. Ventricular septal defect, VSD. D. Patent ductus arteriosus, PDA. Correct answer Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.